Welcome to our presentation for what are speech language pathology and audiology. So this is a presentation to help you think about an alternative to potentially other things you're considering in a healthcare career. So I am so happy to be here sharing this time with you. My name is Gabrielle Gruber, and I'm an advisor that works with students at and before they come to the University of Washington. And it's big to spend a late Thursday afternoon with us with the sun outside. So I really appreciate you taking the time. We know your time is important and we value your attendance. So on Tuesday, I went to I was lucky enough to attend the student and industry panel. And the pictures you hear are pictures and bios of two of our graduate students. One of them is Miss Anna Hutton, and the other is Amanda Ciani, and they were on that panel. And so I was just so proud to have speech and hearing sciences representing. And I learned so much from all those students and how their journey has taken them to their current place. So we want to show you another potential journey that you can take into speech and hearing sciences, which is the study or the major, what you would do in college, that will start you on a career in speech language pathology and audiology. So well, we won't get to the agenda quite yet, but I wanted to talk a little bit about speech and hearing sciences and how it relates to speech language pathology and audiology. This is a major. And so a lot of times students will hear people saying, what do you want to major in? What do you want to study? And that's what speech and hearing sciences is. It's just like considering, for example, some of you might be considering biology or education or dance. And so this is another field to consider, and I think lesser known. And so that's why we are coming to these types of events to plant the seed for you to consider this major. So on the agenda, we're going to talk a little bit about what this field is. What is this? How how do these professions make a difference? What are the career options? Who's a good match for this major? So feel free to put questions in the chat at any time. They could be random, broad, specific. Don't hesitate. I really love to hear from students and what you guys are thinking about. So let's learn some more. So you probably have heard about communication, where you look at sort of the interpersonal, your feelings about how you're speaking. But our field looks at the science of speech, language, hearing, and swallowing. And so it's looking at how they work, how they develop from when you're a baby to a toddler to an adult, and then how do they change as an adult, maybe as you age or through some type of accident or trauma. And so this field studies that speech is the sounds, language is the sentences and the understanding, and hearing is how our brain makes sense of sounds, and swallowing is just as it seems. It's the action of swallowing food and water. So that's what you would be studying if you did this at the University of Washington. This field can allow you to work with people to help them with their speech, language, hearing, and swallowing. And if you love to communicate, as I suspect many of you do, this field is all about communication. It's a great way to help people have a voice and to understand, which is so important in today's world. So these professions will look at these areas, work with them, see where they go wrong, then how do you figure out why they went wrong and what you can do to treat them. Communication makes us human. That's probably one of my favorite sentences. It really relates to me as a human. It's how we socialize, it's how we learn, it's how we work, it's how we have fun, it's how we express our emotions. We're using it right now at this event. You've been using it all week long. It includes speaking, understanding, reading, writing, and hearing. And this field helps students become experts on helping people maintain that and helping them through problems with that. So careers will focus on the audiology side, which focuses on hearing and balance. Audiologists need to finish 4 more years of school after college to earn an audiology doctorate. Speech language pathology, which focuses on speech and language and swallowing, this requires 2 more years of school after college to earn a master's degree. And another area is research. So research careers focus on looking at the deep science of how communication works and developing new ways to treat and diagnose. Generally, but not always, this career option requires a PhD. And so that's called a doctorate of philosophy. And that can take 4 to 8 years after college. So thinking back to that first slide where you saw Anna Hutton, Anna is pursuing the first one on this slide. She's finishing her 4th year in our audiology program, and she will be moving to California to become to work as a practicing audiologist. And then Amanda, the other student, she's doing the third one on this slide. She's doing research. So she's looking at science in the inner ear, the vestibular system, and examining the science and treatment and sort of looking at when hair cells become damaged in your inner ear. So what's really cool about these careers is that speech language pathologists and audiologists can work in a variety of settings. Healthcare, obviously, this is why we were allowed to come to this event because it fits so nicely. You can work in the healthcare setting, hospitals, nursing home, clinics, but there also is an opportunity to work in public schools. If you go the research route, you can work in colleges or research labs and centers. What kind of patients and clients do we treat? We treat everyone. You can work with the entire lifespan from babies to seniors. So that just gives so much variety to this field. And some individuals start with one population, meaning they work with children and maybe switch to working with adults. They start in hospitals and work in schools. Other people stay in the same setting for their entire career. So that's giving you a lot of different options to try new things, to find the perfect fit. The great news is that there's national need for speech language pathologists and audiologists. More children are being helped sooner, right? So we're discovering children need help either with their speech or language or hearing, and so that's happening sooner, and humans are living longer. The job growth for speech language pathology is 25%, and for audiology, it's 13%. And just like the panel, the student and professional panel was talking about, we need diverse professionals. Our student Anna said when they asked her a question, needing diverse professionals, or sorry, we need professionals that reflect who is being treated, seeing themselves back. We need more diverse workforce, which is diverse in language, culture, race, and gender to work with the human population. And there are funding opportunities for diverse students. Who's a good fit for the major? If you love writing, language, helping people, problem solving, science, and brain function, this can be a good fit. So it can really bridge a lot of different sides of students and sort of get you thinking, this could be a great option for me. Plus also with the job growth, there is stable career and salary. For those of you interested in the healthcare side, this is a good fit if you want to work in a fast-paced environment with teams, right? Including doctors, nurses, physical therapists, occupational therapists. You can do that in a medical setting. This is a good choice if you want to use computers and technology to help patients improve their communication. But I will say there's also room, as we mentioned before, for the educational side. If you want to work with children, love working with children, this could be a great fit. And in that case, of course, you'd work with a team of education professionals. And if you like working with a wide variety of ages, cultures, and languages, the education side could be a great option as well. Now I have 2 career story videos to share with you. These are from our national association, the American Speech Language Hearing Association. So we're going to first see profile of Dr. Martine Ellie, who is a speech language pathologist and clinic director at Howard University in their graduate program. And then the second one is from Dave Trina, Celeste Gadsden, who is a speech language pathologist who works in Maryland. Okay, let me know if this audio doesn't work and video.
Graduate and undergraduate students in speech language pathology, specifically clinical practice.
Are you guys hearing that and seeing it?
You're loud and clear. It's perfect.
Awesome, thank you. Is that Lauren?
Yep, it's Laura.
Thanks a lot. Appreciate
Yeah,
it.
sure thing.
Courses, and the courses really are teaching students how to apply the theory that they've learned into the practice when they're working with their actual clients. I'm Martine Ellie, and I'm the clinic director at the Howard University Speech and Hearing Clinic. The younger grades, I decided to become an SLP because I always wanted to do something that would make a difference in people's lives. There's not one typical day, it really varies. I can do things such as teach classes in a day, supervise students that are working with clients, do community outreach. You have different challenges, different opportunities, different things to do. And so that really makes the job more interesting. For the last 2 years, we've gone to Haiti during spring break, and we've provided a number of different services. We have done hearing screenings, dental screenings, and a number of different healthcare initiatives within the community. ASHA is a vital part of everything that I do in my professional life, from certification to professional development, to policy statements, to advocacy, not only for the profession, but also the clients that we serve. I'm passionate about the field of speech language pathology, and so teaching it just allows me to do something that I really like to do. I'm teaching a skill about something that I am passionate about.
I became an SLP because I knew that there was diversity in this field, and I knew that I would have the opportunity to help people communicate. 8 years now in this profession, I wouldn't have it any other way. My name is Trina Celeste Gadsden, and I am a speech language pathologist. One thing that I really enjoy about my day is that it's definitely not routine. You'll say them and then I'll repeat them after you. From working with patients with voice disorders to neurological disabilities and speech to swallowing. Sometimes it might include community outings or working with other therapists to make sure that we're treating the entire patient. One of the most exciting experiences that I've had is working as a travel SLP. I've lived in Chicago, I've lived in Dallas. So just having that opportunity as well as building my career is something that this field has afforded me. My patients inspire me. They have a magnificent ability to be resilient. So Tajay is a 19-year-old college student who had a brain tumor. One thing that prompted this type of outing is that Tajay expressed that she likes to eat out a lot, and her friends and family were ordering for her because of her fear of not being understood. So today was a perfect opportunity to take her out, have her order for herself, and build that confidence that she is intelligible and people understand her. Knowing that Tajay is so close to returning to college and the community is such a rewarding feeling that it's hard to put in words. She is an amazing person, and to have met her at this junction of her life is, I think, more beneficial to me than her. Yeah.
Great. All right. So we've come to the end of my part, and we'll get to questions if I hope you have some. If you would like to contact me away from this event, I've put our general advising email here. It's shugadv@uw.edu. I can put that in the chat as well. And there's some helpful links. Easy to find us. If you Google this acronym SPHSC, you will find us at the University of Washington, and you can look at your undergrad, you can look at the grad school. We have some new videos from our own students. Wasn't able to add them, but they just got posted talking about our department and our major. And you could watch the entire video. There's, I think, a link on our website that ASHA provided to profiling those different specific professions. So I am so excited to stop sharing my screen and see if any of you have questions and or things on your mind as it relates to what you just saw, or maybe even something else. I will sure try to answer them in any way I can. Something that you might want a little bit more information about, that could be it too. If you have a speech disorder yourself, would you be a good fit for working as a speech therapist? That's such a great question. I think that would be Mill or Millie. Thank you. I absolutely do think it's possible to work as a professional with a speech disorder yourself. It's all about how you manage it. And a lot of times students are drawn to this field because of their own personal experience. And so there's a strong level of empathy and understanding. And I think it's just how you utilize strategies to work within your own disorder and managing it, and how you can help clients. But yeah, we've had students themselves who are stutterers, and we've also had students as well who have hearing loss. So it is very doable. What's the favorite part of my job? Well, a full disclosure, this could be an interesting question. Thanks, Emma. I personally am not a speech language pathologist or audiologist. I am a college advisor, but I've seen a lot of speech language pathologists working in the context of college advising, and I've talked to a lot of our supervisors in our clinic. Those are speech language pathologists. So when you go to graduate school, you're trained by the profession, right? So you're trained by speech language pathologists. And then if you get into audiology, you'd be trained by audiologists. As a college advisor, I'll put a little shout out. I love talking to students, and I love seeing and hearing all of the differences that students bring, like why you're interested, or maybe why you're not interested. That just makes me happy. I love stories, right? But what I've heard from people who go into speech language pathology, they really love the details part of it and the problem solving, thinking it through, and then coming up with a plan that really helps the individual. And I think that last video really showed that, how she helped her do a simple task, that going out and ordering your food gives you so much satisfaction. So I think job satisfaction is rated very high for speech language pathology and audiology. Audiology, I've heard from students, they talk a lot about how they like it's a little bit more cut and dry, because when you do a hearing screening or evaluation, you assess by, and most of you, or at least some of you, might have had those hearing screenings when you were a kid, and maybe they, still, where you hear the sound. So there's a defined reading on, yes, you do have a hearing loss. And so audiology students like that black and white, or that very set kind of answer. And so that's what's attractive to them. They also use a little bit more technology. So I think if you're into equipment and technology, that is a big plus too. And helping people, working with individuals who are struggling, and then you either fit them for a hearing aid and they hear something clearly, or you help them with other technological devices they have around their house to make it work for them. You guys ask good questions. Impressive. This is high school students. These are high school students. Is that the population? Is that where you guys are? Or a mix of middle school and high school? Does everybody I could throw out a question for the chat. Do you feel like you know what you're going to major in high school? Thank you. major in college? Do you feel some pressure? Is that something that people talk about? High school. I know what I plan to major in. Great. Well, hopefully it's speech and hearing. Of course, I must say that. But if it isn't, one of the options, there's so many options. Such a true statement, Jonathan. That's a lot of truth right there. Yes, because you're like, which one do I pick? And one thing to sort of go maybe to that, it could relieve some pressure. And maybe some of you know this, you can do more than one, right? So that's something that could satisfy two sides to you, like where you might love the science and the art. So you could do two. It does sometimes take more time, but if you plan it, you can manage it kind of well. And it's sort of a time period in your life where um, you may never have that opportunity. So I always tell students, embrace it if you can. With the more time, that could be more tuition. So I understand that that is a challenge. I think following all the advice you're getting, I think from these panels, I always encourage students to shadow, to try to shadow. Now I know that's hard to do in Corona time, but so what I'm going to say is try to maybe watch some of those videos, a day in the life of, and sort of really delve into, is this what I think I might want to do for a career, and maybe ask individuals, maybe ask if you can meet with them via Zoom and maybe talk about what's your typical day, pros and cons, and that may help you really um, delve in and sort of help you make some good decisions when that pressure is on. And talking to advisors. I know I want to go into the medical field. Unsure what major though. I know you can major in anything before medical school, probably science though, just as biology. Yeah, I've worked with um, some medical students who do speech and hearing sciences. So med school doesn't care what your degree is. They just want you to have all those courses. And so you could, I always say it's like a bag. You can put those biology, chemistry, all those classes, and it could be in speech and hearing, right? You could then also have to do speech and hearing. And a lot of people major in biology because you already have all those credits. But yeah, you could entertain doing this and pre-med prerequisites. What was your past job before this one? You know, this has been my main job. I actually did other things in the department. I worked at the University of Washington in other capacities, like more administrative. And then the advising position opened up, and I always loved talking to students, so, and helping them, because I think with all these questions, that's one of the things about college. It just feels like there are so many questions. I will definitely put a shout out to the University of Washington. If you can navigate the size of it, I do think there are definitely offices that want to help you and they want to give you support. So yeah, if you want sort of some like navigation, like where would I go to learn more, you can always send me an email. And even if it doesn't relate to speech and hearing, I can say, oh, that's this office, and let's get you connected with them to talk about like advising sessions or info sessions just like this, but for something else, because sometimes that's a lot of is just the understanding. Super good question. Is there a certain age you recommend starting to shadow? I think you can shadow in high school. I've had a couple of students say that as part of a high school project. They had to talk with a professional, right, in their field of interest. It's possible some could have an age limit, but I would ask. I would send them an email and just introduce yourself. Most people are thrilled to see young people um, reaching out to them to say, hey, I would love to meet with you. I'd like to ask you about your day. I think eventually you will get someone to say yes. Maybe not the first 2 or 3 emails, but I absolutely think you will get someone. So just literally Google SLP in my area. If you reach out to me, there was a tool where you could sort of track down professionals in your area. And you might not get a meeting, but they might share with you a little bit about their story, about what they recommend you do. And as we continue to come out of the pandemic, in-person shadowing will increase. University of Washington is actually the college I'm most interested in attending. Yay. So I definitely encourage you to go to the admissions website, and they have some video like information for freshmen that sort of gets you thinking about, okay, how do I prepare for that application? When do I need to apply? Planning all that out. Absolutely. And definitely, like I said, send me an email if you have problems finding that. I can direct you. Do camp things where you go around a hospital and such count as shadowing? I think so. I mean, if you're getting sort of a broad overview, I mean, you might see if they are going to stop by at the speech language pathology area or unit in the hospital. A lot of times speech language pathology is housed in rehabilitation medicine. So that's the main like floor or the main unit. And then in there are the speech language pathologists, the physical therapists, and the occupational therapists. So they all do sort of different types of therapy to help individuals after they've had a stroke, motorcycle accident, trauma. And so, yeah, I think that would be so cool. Do those types of things, those summer camps, special things. I think Nora Coronado is here from a group I'm part of, Health Professions Collaborative, and they do have a lot of high school summer health profession opportunities. Definitely let me know, and we can definitely send you some links. She would love to have all of you 11, well, minus me and Laura. Oh, it's